One of my favorite things to read when I was a little boy were the Choose Your Own Adventure novels. You could pick between 3 different options. If you chose wrong, you might get your head chopped off, or you might fall in a hole, or you might make your way out of a haunted house. I like the idea that the story doesn't always end the same. And I think that's really what sets me apart. I cherish the ability to have a process that's not linear, that's not going to have a defined path where there's a beginning, a middle, and an end. It's okay for me if it branches off. If there's a fork in a road, I welcome that because it might take me down another path that in the end results in a better outcome. My name is Dr. Tony Rhorer. I grew up in Chandler, Arizona. I am a board-certified, fellowship-trained orthopedic trauma surgeon. Choosing to go to medical school at Duke was one of the best decisions I made in my entire life. It was absolutely one of the most unbelievable places I've ever been on planet Earth. I was really fortunate to stay at Duke and do my residency in the Department of Orthopedic Surgery, which in my opinion is one of the best in the world. I then was a trauma fellow at the Florida Orthopaedic Institute and Tampa General Hospital. I operated on everything from the clavicle to the toes, people with all 4 extremities, broken, open, bleeding to death, open pelvic fractures, anything you can think of. People run over by cars, dropped out of planes, shot, crushed, mauled. Really unbelievable experience, and I made some really great friends in Tampa, and my mentor, Dr. Roy Sanders, really catapulted my career. When I finished my fellowship, I wanted to come back to Arizona, and I had this vision that I would create a world-class orthopedic trauma program in Arizona. And actually during my residency, every chance I got, I would come home to Arizona and I would meet with other orthopedic surgeons and say, hey, I'm gonna do a trauma fellowship and I wanna base a program purely on trauma. And everybody I spoke to said, you can't do that. This is the Wild West. Everybody takes trauma call. We don't have fellowship trained trauma surgeons. You're gonna fail, but we're happy to have you join our group and you can do general orthopedics. And at one point I finally just said, you know what, no one hears me, nobody sees my vision, I'm gonna do this on my own. And so I started my practice on August 1st, 2005 out of the trunk of my 2002 Ford Mustang. Ultimately, I was named the medical director of orthopedic trauma at the hospital. To this day, we now have 8 fellowship trained orthopedic trauma surgeons. We work at 4 level 1 trauma centers in the Valley of the Sun. We have had an orthopedic trauma fellowship for the last 6 years. We've published numerous articles. I have lectured on orthopedic trauma on every inhabited continent on Earth. And we, as a group, operate on about 5,000 people a year. We answer to God and we answer to our patients. And we follow the textbooks and we follow the teachings of the great people who came before us that taught us how to be orthopedic surgeons and how to be healers. And we will stand our ground to the very end. We really believe strongly that this sets us apart and it makes us different, that these are the things that made healthcare so great in America. People who wanted to really take care of people and do an amazing job of doing it and not answering to anybody else. It's been a really incredible experience. It's been a whirlwind, and I've seen a lot of change just in the last 12 years in healthcare. But in the end, I still am an orthopedic trauma surgeon, and I get up every day because I can't believe I get to make a living taking care of people. And not only am I taking care of people, but I'm saving their lives.